is 8:03. What a beautiful sunny Monday morning. Thank you everyone for joining us. I guess we could start. So for today, we will have our PCN team presenting the newer program that we have, Metabolic Health and Lifestyle. But before we begin with our formal presentation, I would like to begin us with a land acknowledgement. We are honored to gather today on the traditional, ancestral, unceded and shared territories of the Kwetland, Matsqui, Katzie, and Métis First Nations. We recognize that these lands are also home to many Inuit and urban indigenous populations. Before we begin today's presentations, I also would like to go over a few housekeeping items, introduce our PCN team, our group of presenters, and also our agenda. First, housekeeping. Please note that today's sessions is being recorded. The recording will be saved and made available to our website for future reference. If you have not done so, please make sure that your camera is on and also your first and last names are displayed in your Zoom profile for attendance. If you are having issues with your displayed name correctly, please email me, send us a message or Manita to ensure that you are included in our attendee list. To maintain a smooth presentation, we kindly ask everyone to please keep your microphone muted, unless of course you're one of the speakers. We also have a designated question and answer session at the end of the presentation. So we encourage you to submit your questions at any time throughout the presentation using the chat feature or by sending them directly to me. Lastly, at the conclusion of today's session, you will receive a brief survey via email. We would greatly appreciate if you could provide your feedback. It helps us evaluate our programs and also continue to improve the future learning opportunities. Next slides, please. Thank you. All right, meet our team. The outstanding team behind Langley PCN is shown on the screen. I know calling the team outstanding makes me a little bit biased because my name is also on the list. However, that's not the point. The point is this list shows that in a relatively short period of time, we have not only launched key programs, but we have also successfully filled most of the positions to support service implementation. And that is thanks to my PCN partner in crime, Fraser Health, UPCC and PCN manager, Janine. So most of our team in our PCN team are actually present in today's call. So hello, everyone, and thanks for being here. Next slide, please. However, for today's presentation, we will have the following presenters. So we'll have 3 registered nurses, Cam, Priscilla, and Sonia. Rita, our registered dietitian. Chris, one of our clinical pharmacists, and Tyler, one of our clinical exercise physiologists. Also, I would like to have a special mention to Manita, our program coordinator, who is supporting us behind the scene, currently waving, with all things technical. Thanks, Manita. Next slide, please. Agenda. So for today's presentation, we will begin by sharing some of our key highlights of our FFPP. That is our Fragility Fracture Prevention Program, a program we've launched just over a year ago. Next, we will move into the metabolic program presentation and also share some of the provider and patient feedback. And finally, we will have the questions and answers. With all of that, I would like to invite Priscilla to start us with FFPP highlights, please.
Good morning. My name is Priscilla, and I'm one of the RNs in the program. We began the Fragility Fracture Prevention Program in March 2025, and the program was built to support patients at risk for osteoporosis, for those at risk for falls and fractures, and we also wanted to catch those that might be missed after a fracture. Next slide, please. So this is our workflow. We receive referrals through 3 pathways, through GPs and NPs for their at-risk patients, and those patients who want to know more about their bone health. Each week, we screen the Langley Hospital CAS Clinic for patients that have had hip fractures. These patients are then offered participation to our program, and this is to catch patients who might otherwise be missed. We've also expanded our service delivery to include group-based education sessions. So through partnerships with the Langley Seniors Resource Society and Langley Meals on Wheels, the program is offered to patients in Fort Langley, Langley City, and out in Aldergrove. So you might have your patients come to you after they've attended one of our education sessions, asking you for a referral to our program. In our program, your patient will have time with nursing, pharmacy, or dietitian, and exercise physiologist, where a FRAX assessment is done, a falls assessment, and a medication review are all done, along with education and the creation of a bone health plan. A summary of the intake then is sent to you with recommendations from the team on the first page, followed by individual assessments. Pharmacy may recommend osteoporosis medications, bone density, blood work. Next slide, please. So we've received about 102 referrals to our program. 23 patients have been referred to the Fraser Health Falls Prevention Clinic. Pharmacy has made recommendations regarding starting or switching osteoporotic medications for 21 of those patients. 12 patients were recommended to get bone density baseline testing. We've held 7 fragility fracture prevention program group education sessions and had 104 participants attend those. And then 43 patients from the CAS list have been screened as eligible for our program. Next slide, please.
Hi there, I'm Tyler. I'm the clinical exercise physiologist, and I'm going to talk about our proactive approach to falls prevention. Our goal is to support patients at risk for osteoporosis, fractures, and falls. We want to support primary care providers with their patients that are at risk. One of the ways that we support our providers is through our proactive approach to falls prevention. This includes an assessment of balance, grip strength, and leg strength, falls prevention education, referrals to the Fraser Health Mobile Falls Clinic if suitable, and a pharmacist reviewing and screening medications that may lead to increased risk of falls and providing recommendations back to the provider. Next slide, please.
So some of our successes look like these: either adding calcium or vitamin D supplements for those not meeting recommended daily allowances, finding alternative calcium sources, reintroducing exercise to their day by adding movement to their at-home routine, learning about spine safety and how to do both ADLs and exercise safely, creating exercise routines with our CEP, starting a laundry after discussion of risks and benefits, perhaps switching to Prolia due to side effects or pill burden, getting safety equipment like hip protectors, lifeline, and safety check-ins established, screening for signs of undiagnosed vertebral fractures, and also checking in with patients at 6 and 12 months to follow up with their SMART goals, their medication compliance, and if they have had any falls or fractures during their treatment. Next slide, please. Mary is an example of one of our cases. She is a 54-year-old female. She had early menopause and consumed a low dairy intake her whole life, and she had a low activity lifestyle. So using the FRAX, her 10-year risk for major osteoporotic fracture was calculated, and she was at moderate risk. Her understanding was that she had low bone mass for her age, but didn't realize that she had osteoporosis. She had beliefs about taking osteoporosis medications, scared of the adverse reactions, and wasn't currently on any treatment. We spent time with her, explained what her diagnosis meant, reviewed the benefits and risks of treatment, and ways she could support her bone health. Pharmacotherapy, supplementation of calcium and vitamin D, and exercises were all recommended to her and her provider. At her check-in, Mary had seen her provider. She had started a laundry and was supplementing daily with calcium and vitamin D and had connected with the CEP and started an exercise routine. Next slide, please. Feedback from our patients has been positive and inspiring. I'll share the comments made by some of our participants. It was really nice to have time to learn and understand what is happening and how to make changes. What a great program. I learned so much, even though I thought I knew a lot. This is a result of your work and ours, so let's keep building on this momentum together. Next slide. In summary, we know that 1 in 3 women and 1 in 5 men will have an osteoporotic fracture in their lifetime. We know fractures affect how people feel, how they move, and where they live. So we want to thank you for working with us to prevent falls and fractures, reducing the risk of subsequent fractures, improving the life of your patients, and optimizing healthcare resources. Thank you very much.
Thank you, Priscilla and Tyler. As you have heard, the FFPP program offers valuable support for patients. So if you have not yet referred your patients to this program, we encourage you to consider those who may benefit from the services. Now we'll move into our metabolic health presentation. To start us with, I would like to invite Chris to begin.
Thank you very much. Just to introduce myself, my name is Chris Gorniak, and I'm one of the PCN clinical pharmacists. And this is an introduction to the Metabolic Health and Lifestyle program. So why we chose the metabolic program is there's a growing rate of diabetes and heart disease. 19% of all Canadian adults, nearly 1 in 5, have metabolic syndrome, and most are unaware of it. It's estimated 40% of people over 65 have metabolic syndrome, and we feel that healthy lifestyle changes can make an overall difference. Next slide, please. So the metabolic program is a 12-month multidisciplinary program with an RN, dietitian, pharmacist, and certified exercise physiologist. Individualized care plans based on patient needs and barriers. It includes intake, medication review, nutrition and activity guidance, with frequent check-ins to support our patients. We focus on lifestyle change. It is not specifically a weight loss clinic, and improving metabolic health, mood, and sleep. Our goal is to empower self-management, reinforce sustainable healthy behaviors, and to support primary care providers by providing education and patient support. Next slide, please. Health markers considered, looking at blood pressure control, hemoglobin A1C, lipid profile improvement, including LDL, triglyceride, HDL, looking at weight change, beginning and end of program, and grip strength. Next slide, please. So the inclusion criteria, again, just looking at the outline of metabolic syndrome as defined as meeting 3 of the 5 criteria. With physician discretion and patient interest, we will accept any patient who fills at least 1 out of the 5 criteria. With abdominal obesity, elevated triglycerides, low HDL, elevated fasting glucose, increased blood pressure. What we wanted to do is make our program open and inclusive and look at focusing on prevention. Patients must also be 18 years and older, able to follow direction and advice, willing to participate in a 12-month program, and are attached to a primary care provider in Langley. Next slide, please. Our exclusion criteria are palliative or long-term care patients, multiple complex conditions. Again, what we're looking at is just patients that would be able to participate in our program, or immobility. Next slide, please.
Right, so shown here is the new referral form that includes the programs offered by the primary care network. You'll see the fragility fracture prevention program, but highlighted here is the metabolic health and lifestyle program. We have put a box around it for you to see. Here you can check mark as many of the 5 diagnostic criteria for metabolic syndrome, which are relevant to your patient. We have also included a checkbox area for you to indicate whether you give medical clearance for your patient to participate in and receive an exercise program. We do ask for you to mark this off so we know if they are able to safely participate. If your patient is not suited or cleared for exercise, they will still receive education from all providers within the program, but they may not receive an exercise routine. We'd also like to note that a resting blood pressure greater than 180 systolic or 110 diastolic is a contraindication to exercise. So if a patient is referred to the program and has elevated resting blood pressure close to that range, we will be seeking additional clearance. So by check marking this, you can help prevent any delay of them receiving care. They will still be seen by the CEP, but will receive education only on light aerobic exercise until the blood pressure has come back down and is better managed. Next slide, please.
Hi everyone, my name is Garita Narayan and I am the registered dietitian for the Langley PCN. So when a patient is referred to the Metabolic Health and Lifestyle program, they can expect a team-based approach to care. The program begins with an initial one-on-one appointment with each core clinician, including the registered nurse, the dietitian, the clinical exercise physiologist, and the pharmacist. These initial appointments are designed to provide a thorough assessment and support the development of a personalized care plan aimed at optimizing each patient's health markers. Over the course of the 12-month program, patients will have regular follow-up appointments with our team to support their progress and to adapt their care plan as it's needed. So this typically could include approximately 6 to 7 visits with the RN, 4 to 6 appointments with the dietitian, 4 to 5 sessions with the CEP, and at least 1 consultation with our pharmacist. And to note as well, additional appointments with any of our clinicians may be scheduled based on individual patient needs as well. And depending on the patient's goals and their circumstances, the program can also facilitate connections to additional supports within our PCN network. So this could include clinical counseling and referrals to our social work services as well to provide well-rounded care. Next slide, please. Okay, so at the RN appointment, patients can expect an initial comprehensive intake that includes a review of their medical and their family history. So during the appointments, patients will gain a better understanding of both modifiable and non-modifiable vulnerabilities for metabolic syndrome. They'll also gain a better understanding of ways to reduce the risk of diabetes, heart disease, and other chronic conditions while building sustainable lifestyle habits. With pharmacy, during a pharmacist appointment, patients can expect a comprehensive review of their metabolic health and cardiovascular risk factors, including blood pressure, cholesterol, blood sugars, including A1C, weight and waist circumference. The pharmacist will review current medications, supplements, lifestyle, and discuss any individual health goals that are important to the patient. The appointment is centered on education and personalized risk reduction strategies. The pharmacist will work collaboratively with a patient to review their lab results and assess risk for conditions such as heart disease, stroke, and type 2 diabetes, and discuss evidence-based options to improve their overall health. These strategies may include recommendations related to nutrition, physical activity, sleep, weight management, smoking cessation, and when appropriate, medication therapy. Throughout the visit, the pharmacist provides guidance to help patients better understand the risks and benefits of different treatment options. They also collaborate very closely with the broader metabolic health team so we provide a coordinated, individualized care tailored to each patient's needs. At the dietitian appointment, the focus will be on gaining a clear understanding of the patient's current eating habits, their current eating patterns, their nutritional intake, and their relationship with food. This includes exploring meal timing, food choices, portion sizes, and any habits or routines that may influence their overall health. The dietitian will work collaboratively with the patient to develop individualized nutrition goals and a care plan that aligns with their lifestyle and readiness for change. Education emphasizes practical, evidence-based strategies to support metabolic health, including balanced meal planning, improved food quality, and building consistent eating habits. So there is a strong focus on sustainable behavior change, helping patients build realistic routines, overcome barriers, and develop confidence in making healthy choices in everyday life. The overall goal is to enhance nutrition knowledge, strengthen self-management skills, and support long-term health outcomes. With the CEP, the focus on the patient's with the CEP, the focus will be on the patient's current activity and exercise habits, and work with them to develop a plan that meets their current exercise guidelines and recommendations to support their cardiometabolic health and goals. Education is provided over multiple sessions on ways to increase their exercise levels and to support their health and goals. During the initial appointment and follow-ups, patient's grip strength, lower body strength, and balance will be assessed and tracked. The CEP then ensures the patient is provided with appropriate exercise resources and discusses any necessary safety precautions depending on the patient's symptoms and limitations. Next slide, please. And so what can the provider expect from us? At the end of the intake sessions, providers will receive a summary of care that brings together recommendations from each of our team members. It will highlight the key considerations for the provider up front, followed by the goals and the strategies that were reviewed with the patient during the initial visits. Patients are encouraged to maintain regular follow-ups with their primary care providers as our program supports and complements provider-led care. Next slide, please.
Hi everyone, my name is Cam. I am the registered nurse with the Primary Care Network team. Just want to go over some quick statistics. As part of this soft launch earlier this year, we reached out to top 20 referrers of the PCN services to inform them about the program, its objectives, and the referral process. We officially began seeing patients on March 10th of this year. Since this time, we have received 73 referrals and have completed at least an initial appointment for 34 appointments. On our next slide, I'm going to go over some success stories. A bit about our program. I'm going to walk you through our patient journey. The big focus here is lifestyle modification. It's supported by each discipline working together. What we're really aiming for is improving health markers like blood sugar control, cardiovascular risk factors, and mental well-being. And just as important, we want our patients to feel confident managing their own health. So patient empowerment is a huge piece of this model. On our next slide, we're going to talk about a patient. So let's start with our first case, Rose. She is a 39-year-old female in her pre-diabetes range with an A1C of 6.1%. She also has elevated cholesterol and triglycerides. Her medical history is quite complex. She's had an IVF pregnancy, gestational diabetes requiring insulin, preeclampsia, and she also has high blood pressure and sleep apnea. From a lifestyle standpoint, she struggles with low physical activity, poor sleep, and inconsistent eating habits, especially low protein intake. She has the urge to have a bowel movement during work hours, leading to skipped lunches. She reports low mood, which is important because we know mental health can really impact someone's ability to make lifestyle changes. Her goals were to enhance her self-esteem, regulate her bowel movement, and lower her A1C in 3 to 6 months. So on our next slide, we're going to talk a little bit about the interventions and the outcome for her. For Rose, we took a comprehensive approach. We recommended statin therapy along with reproductive counseling given her history. On the nutrition side, we focused on building a more structured and consistent eating pattern and increasing fiber and healthy fats to support metabolic health. We also addressed sleep hygiene and encouraged gradual increase in physical activity. And just over 6 weeks, we started to see some changes. Her A1C dropped from 6.1% to 6%. Her bowel habits became more regular, and she developed more consistent eating patterns. But what's most important here is how she felt. Her confidence improved, her mood improved, and she felt more comfortable with eating during her workday. So we can see there was a physiological benefit with our support for her. On our next slide, I'd like to talk about another patient we've had. Next, we have Rigatoni, who is a 78-year-old male. He has a long history of high blood pressure, type 2 diabetes, and high cholesterol, along with chronic back pain. He came in with elevated blood pressure and some significant lifestyle challenges. He reported poor stress management, feeling of loneliness, low mood, and sedentary behavior. He also had nighttime snacking habits, which consisted of handfuls of chocolate almonds and jube tubes, which were contributing to his overall metabolic health. So in his case, we're really seeing how social and emotional factors were closely tied to his physical health. On our next slide, we'll talk about our interventions and outcomes for rigatoni. For rigatoni, we combined lifestyle counseling with medication optimization supported by the pharmacy team. We also introduced resistance training, which is especially important for older adults. Within 6 weeks, we saw meaningful improvement. His A1C went down from 7.2% to 7%. His fasting glucose improved, and his blood sugar readings were also consistently within target range. He also lost some weight. He mentioned he needed new pants, which is always a nice tangible outcome for our patients. More importantly, his self-esteem and motivation improved. He gained more knowledge about nutrition, activity, stress management, which helped him sustain these changes. On our next slide, I'd like to talk about our third patient, Willow, who is a 65-year-old male. He presented with metabolic concerns such as elevated fasting glucose, high cholesterol, and elevated blood pressure. Key lifestyle factors here were to improve the heavy alcohol use, the poor sleep, and chronic stress. So again, this is a good example of how multiple lifestyle factors tend to cluster together and drive health outcomes. On our next slide, I'd like to review the interventions and outcomes for Willow. We focused on lifestyle coaching, particularly around nutrition, sleep, and alcohol awareness. We set realistic fiber goals of about 25 grams per day that he could work towards over the weeks, slowly increasing fiber daily, and he was referred for clinical counseling for stress management. Over 2 months, we saw a significant improvement. His blood pressure dropped, his sleep improved to around 7 hours a night, and he lost 14 pounds. But just as important, he reported better mood, improved communication with his partner and family, and was more engaged in his overall care. So I'd like to talk about some of the key takeaways on our next slide. To wrap up, First, our multidisciplinary approach can lead to meaningful improvement in a relatively short time, even within 6 weeks. Second, combining lifestyle changes with appropriate medication optimization really drives measurable outcomes. Third, behavior change doesn't just improve physical health, it also has a strong impact on mental well-being. And finally, empowering patients is key. When patients feel confident and involved, they're much more likely to sustain these changes long term. So we encourage our patients to continue ongoing communication with their primary care providers, and the program really reinforces and supports provider-led treatment plans. On our next slide, Sonia will go into a little bit more detail about some of the patient feedback that we've received.
Hi, my name is Sonia, and I'm another registered nurse with the Primary Care Network. And like Pam said, I'd like to just take a moment to highlight patient feedback we have received with the Metabolic Health Program. At the 6-week follow-up, a client had mentioned, I was actually looking really forward to coming in today and speaking to you. People have noticed changes about myself that I haven't even noticed. During one of the education sessions, a patient had said that this is an amazing program. You have provided a lot of hands-on teaching. This is beneficial for me to take my own step to support my health. There is so much I didn't know. And again, at a 6-week follow-up, another patient had said, the dietitian is so kind and very supportive and has helped me make dietary changes. Thank you, Cam, for encouraging me to get active. I was doing 10 minutes of activity prior to the program inconsistently, and with your help, I am doing 30 to 45 minutes each day. I now realize the importance of daily movement. My mood is better, and people are noticing I am happier. Thank you. Next slide. So we like to take this opportunity for any provider to give feedback. I know Glyza had mentioned there can be questions written in the chat, but this is the end of our presentation. So we thank you again for attending. Questions and answers, please. Next slide.
Thank you all, our presenters. Before we move into our question and answer portion, I would like to invite one of our providers who referred patients during our soft launch to share a few reflections on her experience referring patients to the program. Nurse practitioner Karen Owl, if you don't mind speaking and providing us a little bit of a feedback, please.
Hello, good morning. So I've referred a few patients so far, and they actually go out of their way to tell me to make sure that I know that it's a really good program. I don't really even ask their feedback a lot of the time, and they just say make sure that you provide other people because they've had such a positive experience. They really appreciate the regular check-ins. I think it's difficult, as everyone knows, to portray our decision making in an appointment to let the patients know that really this is individualized for them. Whereas with the regular check-ins with, different members of the team giving the same message, they can see how the things that they're hearing are individualized to them, and so it really gets the buy-in. And gets them just engaged in their own care, which I think is the most important thing. I was a little bit envious, to be honest, to hear these feedbacks. So this is what I wanted to be doing when I went into primary care. Because we know that is the most important thing for long-term, for our life and what makes the biggest difference. So really consistently just positive messages from all of my patients. They feel, even with all the information they're getting, they feel very supported, not overwhelmed. And they are making small changes a little bit over time. They'll tell me about them, and just a really positive experience. I will say it will depend on the patient, of course. So if the patient's not engaged in care with you, or perhaps not going for labs and things like that, they probably aren't the best patient for this because there is some engagement required. But all the patients that I've sent has just been a consistently positive message. So thank you for the program, and that's my feedback.
Thank you so much. Appreciate that. All right, with that, we'll now move into our question and answer session. I have We see a few. Wonderful. Awesome. Thank you. Okay, we can start with the first one. Are the visits in person, virtual, or a combination? I can answer this question, but if any of our presenters would like to answer as well, please go ahead and mute yourself. All right, I'll answer it. The program is actually a combination. We usually ask the patients their preference. However, the initial appointment with the registered nurse will always be in person because they do quite a bit of physical assessment, and also with the CEP, exercise physiologist, the follow-ups and education sessions with the dietitian, follow-up with the nurses and other multidisciplinary would be virtual. I hope that answered that question. The other question is, throughout the program, how is progress communicated with the patient's family physician? Are notes sent after each session, or is a summary sent after completion of the program? Great question. Thank you for that. One of our presenters, could you please answer that question?
Yeah, I can answer that question. So typically after the patient sees all the clinicians, such as the nurse, exercise physiologist, pharmacy, dietitian, we create a summary for the provider with recommendations to the provider and recommendations we've made to the patient. That gets sent over as soon as all the patient appointments are done. So within 1 to 2 weeks. Sometimes it can take 3, depending on the patient and when they're booked. And then typically at 3 months, there is another summary sent from an RN appointment. So far, we're only 3 months into the program, so that's as far as we've gotten, but there would definitely be a summary at the end of the program, which is at 12 months. I hope that answers that question.
Yeah. And for those people who had sent us their questions, please feel free to unmute yourself now if you have any follow-up questions while our presenters are answering them as well. Okay. The next question I received, how are labs ordered during the program?
I can take that. We are not ordering labs, but if we have any recommendations, we would pass that on for the physician to consider ordering lab work. So again, it's going to be on a recommendation basis. Thank you.
Any follow-up questions before I read the next one? I just want to ask, because this was asked from some of the doctors that we've talked to. They are also asking, is there any labs that you guys would require when sending a referral to the program? Like a pre-ordered labs or lab results that you guys would require as baseline before sending a patient to the program?
It would be helpful to have a recent lipid panel and just basic electrolytes. Just general lab work would be helpful. And hemoglobin A1C if appropriate.
Thanks, Chris. Okay, the next question is, I hear lots of talk on exercise, but not sure what format this takes. For example, directions versus group or one-on-one sessions. A lot of people will refer to fracture risk or metabolic issues. Don't know how to exercise at baseline. Specific oversight on balance training for fracture risk would be helpful. I heard a discussion in the fracture risk program about guidance switching to Prolia if pills are not ideal. Is a class excluded for some reason? All right, let's start with the exercise question. Directions versus group versus one-on-one format of the exercise?
Yeah, so I can definitely touch on this part of the question, the exercise question. So during the initial appointment with myself, the clinical exercise physiologist, we spend a lot of time going over the current exercise habits, whether there are or aren't any history of exercising with the patient. And then during that time, I do provide them with an exercise routine, either a handout, I can email it to them or show them videos, and we go over the form of each movement during that initial appointment so that they feel comfortable continuing on at home. We also talk about resources in the community, which might look like a group exercise class that they go seek out in the community. So they are provided with lots of resources and education on how to start with that exercise habit. And then we do frequent check-ins to see how their progress is going and making sure that they still feel comfortable with all of those movements that we talked about. I hope that answers your question there.
Thanks, Stella. Again, if you guys have any follow-up questions, please feel free to unmute yourself and connect with our presenters. There's a follow-up question with that is regarding Prolia. Switching to Prolia if pills are not ideal, is a class excluded for some reason?
Oh, so we did have one case where we had a fragile senior who was at high risk who wanted a reduction in pill burden. And in discussion with their MRP, it was felt that Prolia might be beneficial for this very specific patient, and family knew the risk and lifelong therapy. Uh, Again, a class A is appropriate as well in many patients, but this was just a very specific incident. So again, providing education, working with the MRP to come with to that decision.
Thanks,
Thank you.
Chris. I received a last comment, is not a question, but also would love to read it out. Sounds like a comprehensive program covering a lot. Okay. So that is the end of the questions we have received through the chat. However, I would like to give everyone another moment in case any final questions come to mind. Again, please feel free to just unmute yourself. Just kind of check if anyone would put their hand up. Oh, perfect. So one more question, a couple more. I'm wondering how the team feels about patients who are less enthusiastic about changes. This is a good fit for the programs. Anyone from our team?
I think what we try to do is meet patients where they're at, and even looking at small improvements may be beneficial. If we can help somebody with some sleep hygiene, they're getting better rest, they're feeling better, a little bit more active. It's meeting people where they're at. If somebody has very strong resistance to participation in this type of program, again, it can be difficult to achieve results, but we try to support people, provide good education, and hopefully look for improving those habits that lead to better health. So again, we try to work with everybody to achieve some measured improvement. Thank you.
Thanks, Chris. Okay. Another question. Is there any role for small group exercise sessions for patients, either now or in the future of the program?
Yeah, so that's a great question. It would be a fantastic thing to include into the program. However, right now we are not at capacity for that, but it's not something that is, excluded of possibly including in the future. Yeah, so again, there we try and recommend them reaching out to 2 different resources in the community if group exercise is something that they are looking for.
Thanks, Val. All right. Any other questions? Okay. If there are no further questions, we would like to thank everyone again for taking the time to join us this morning. We always appreciate your engagement and your ongoing partnership in supporting patients within our community. If you have any questions about our PCN programs, there should be a slide with our contact information. Melita, if you don't mind putting that up, please. Wonderful. Thank you. All right. So our contact information is on the screen. Please do not hesitate to reach out at any time, and we would be happy to connect with you. It's only 8:49 in the morning. Enjoy the rest of your day. It's quite sunny and warm. So thank you so much. I will gladly give you back a few minutes of your time, and we hope you have a wonderful rest of your day. Bye for now. Thanks, everyone.